According to a study from 2015 to 2016, the prevalence of obesity in adults has increased to 40%, which is up from 10 years ago. So obesity affects over 94 million adults in the United States, according to the CDC, or the Center of Disease Control and Prevention. Obesity-related diseases are heart disease, high blood pressure, type 2 diabetes, stroke, and certain types of cancer. And these are all some of the leading causes of death in the United States. Childhood obesity remains stable over the past 10 years and affects about 18.5% of children. The prevalence of childhood obesity is higher in children after the age of 6 than in earlier years of life. People are considered overweight or obese when they weigh more than what is considered a healthy weight for their height. The body mass index, or the BMI, is a screening tool for obesity. If a person's BMI is less than 18.5, that person's considered underweight. A BMI higher than 18.5 but less than 25 is considered normal. A BMI higher than 25 but less than 30 is considered overweight. And then finally, a BMI 30 or higher is considered obese. Joint problems are associated with the obesity, and other related lung disease problems can happen. People with diabetes mellitus need to monitor their carbohydrate intake. Remember that carbohydrates are broken down into glucose in the body. Insulin moves the glucose from the blood into the cells. For people with diabetes, the body either does not make enough insulin or just doesn't respond to insulin produced. As a result, their blood glucose levels are high. In the absence of insulin, the body metabolizes fat and then uses the ketones for energy. Ketones build up in the body, so too many ketones can lead to ketoacidosis, which is actually a life-threatening condition for everybody, whether diabetic or not. Now, over the years, several different diabetic eating plans have been created for people with diabetes. You'll hear of patients being on diet plans such as an exchangeless system. Now, this diet plan groups similar foods that have the same amount of carbohydrates, protein, fat, and calories. Each food item had a measurement, and it, for instance, a cup, 1 cup, and it indicated how much could be eaten for that exchange. 3 main groups were given to the plan: a carbohydrate group, meat group, and fat group. The American Diabetes Association encourages the following diabetes meal plans: the glycemic index approach. Eating lower GI or glycemic index foods helps one to maintain a more stable blood glucose level. So the idea is to fill half of the plate with a non-starchy vegetable, so that would be your beans, broccoli, carrots, salad greens, and peppers. And then you split the remaining unfilled side of the plate in half. Then the one small half is filled with a protein. So proteins are like lean meats, poultry, and fish. And then the other small half is filled with a grain and starch, like a starchy vegetable. So that would be like your brown rices, your potatoes, squash, green beans, or corn. You're supposed to then complete the meal with a serving of fresh fruit and a serving of dairy, a milk product like that. And then a non-sweetened beverage. So carb counting or carbohydrate counting is a meal planning tool used by people with diabetes. And using this method, a person keeps track of the amount of carbohydrates eaten each day. Carbohydrates are measured in grams. This system gives some people better control of their diabetes, but it is a learning process. The person needs to identify which foods contain carbohydrates and how to estimate the number of grams. So the total grams are calculated over the day. Some people with type 1 diabetes may need to adjust the amount of insulin they take for a specific meal based on the amount of carbohydrates that they're going to consume or eat. Dietary approaches to help with cardiovascular disease is also called dietary approaches to stop hypertension, or DASH. And it's flexible eating plan recommended for people with hypertension and cardiovascular disease. So the goal of the plan is to reduce the blood pressure and the LDLs and triglyceride levels. The Heart Healthy Diet, or DASH, is a diet and lifestyle recommendation by the American Heart Association, and it closely resembles the MyPlate guidelines. So the AHA, or the American Heart Association, incorporates a focus on exercise along with a healthy diet. Some of the recommendations are to limit sugary drinks, sweets, fat meats, and salt, or highly processed foods. Kind of going back to nature and the simplicity of food. Patients are encouraged to read labels and select products with the lowest amounts of sodium, the lowest amounts of sugar, and saturated fats. They're encouraged to eat fewer than 2,400 milligrams of sodium a day, and that's to help lower their blood pressure. They should be physically active, walking, running, swimming, and balance their calories so they're burning those calories during exercise, and the calories they're consuming are maintained to help maintain their weight. Drinking alcohol in moderation is a must, and women should have only 1 drink, while men can have 2 per day. Patients undergoing radiation and chemotherapy for cancer can experience issues that affect eating. The treatments can harm fast-growing cells in the lining of the mouth, lips, and intestinal tract. Patients may have mouth sores that cause pain and swallowing problems. Taste and smell changes can occur, and the treatments can cause appetite changes, diarrhea, constipation, fatigue, dry mouth, nausea, vomiting, and weight gain or weight loss. So good nutrition is critical for people to regain their strength and to heal after the treatments. So a registered dietitian is commonly involved with the team of healthcare professionals caring for patients undergoing treatment. Nutritional tips for patients undergoing cancer treatments include eating a soft, bland diet, eating 6 to 8 small meals a day instead of 3 large meals, and to attempt to eat high-calorie, high-protein snacks like hard-boiled eggs and peanut butter, nuts, supplements, have some trail mix, maybe even some canned chicken. They should take only sips of liquids during meals, drink most of their liquids between meals, and then about 8 to 10 cups of liquid a day, and this is to help prevent constipation and dehydration. They could drink things like water, prune juice, even warm liquids are helpful. In order to reduce mouth dryness and sores, they should limit caffeine and alcohol, and then keep their mouths clean using water or a mild mouth rinse. They should avoid tart, acidic, or salty foods, and then eat lukewarm or cold, soft, and creamy foods, and use anesthetic rinses prior to eating. Cancer patients should avoid foods with strong odors and those that are overly sweet, spicy, greasy, or fried. They need to eat small bites and chew the food well. Eating dry foods like crackers and toast is preferred. In addition, They can use a straw or a small spoon and pureeing food as needed. Sucking on hard candies and ice chips can soothe the mouth and prevent mouth dryness. Another way that a cancer patient can prevent constipation is by increasing fiber through a calculation of total parenteral nutrition, TPN, to make sure that they are getting all the nutrients they need. A food allergy occurs when the immune system overacts to a protein in the food. The immune system makes IgE antibodies in response to the protein. So this causes the person to quickly experience an allergic reaction or an allergy symptoms. Symptoms may include itching, hives, nausea, and vomiting, diarrhea, difficulty breathing, which would include tightness in the throat, coughing and wheezing, or even an anaphylactic shock. 8 allergies make up about 90% of the food allergy reactions. So these 8 food allergens can be hiding in ingredient lists under other names. And here's some examples. So milk. Milk could be listed as cream, casein, ghee, galactose, lactoalbumin, lactose, and whey. While eggs could be listed as albumin, eggnog, ovalbumin, and ovomucin. Fish can be hidden with the terms cod, bass, flounder, the name of the fish. Crustacean shellfish. These are crab, lobster, and shrimp. Tree nuts are almonds, cashews, filberts, hazelnuts, marzipan, nut meal. And then peanuts is like peanut butter, peanut flour, peanut oil. Wheat can be hidden by the terms emmer, einkorn, durum, kamut, modified wheat starch, wheat bran, and wheat germ. And finally, the last example is soybeans. Soybeans can be hidden in words like tofu and soya. So it's important to realize that parts of these foods are used in other foods. For instance, milk proteins, whey and casein, and milk sugar, lactose, they appear in some surprising foods, and medications, and even hygiene products. So some examples include chicken broth, deli meats, and hot dogs, French fries, shampoos, and conditioners, dry powder medication inhalers, and some medications. So it's really important to read the ingredient list. It's really critical for those with allergies. All these things are hidden in there, and they could literally be lethal to some folks. When people suspect a food allergy, the elimination diet can be used. People remove the suspicious foods from their diet. They may need to track what they eat and how they feel. Slowly they add the suspicious foods back into the diet, one food at a time. So this process helps identify the allergen. In some cases, a cross-reactivity may occur, and the person will have additional food allergies. An allergist can help identify additional food and environmental allergies. As medical assistants work with patients from various cultures, it's also important to know more about those cultures. Many cultures have dietary traditions that influence how they respond to illness. In some cultures, food is considered a cure for illness. For instance, in the Mexican culture, when people are sick, they are out of balance in that they have too much heat or cold. To correct this balance, the person needs to eat foods of the opposite quality. It's important to be sensitive to these cultural practices. If the dietary change conflicts with the cultural practice, it's important to talk with the provider. A referral to a registered dietitian may provide the patient with extra support and information. And this concludes our lecture for Chapter 33.